Hello everyone, here again is Upstream Health with Ify. How is everyone doing? I hope everyone is doing okay. And I just want to say a quick big thank you to everyone that has been sending me questions. Believe me, you've been getting me motivated to, come out here every day to put up important information, healthy tips on how to live a quality life. So today I'm going to be discussing cleansing, detoxification in relation to cancer, hormonal imbalance, chronic conditions like diabetes, cholesterol condition, autoimmune diseases, weight loss. So you're going to be hearing me use this word cleansing or detoxify. So the question is, what is cleansing? What does that mean to you? When you hear somebody say, oh, I'm going to go through a cleansing process, what does that mean to you? Have you ever detoxified? Have you ever cleansed? So I hear a lot of people say, oh, this weekend I went for a party and I ate all sorts. I need to clean out my system. And they embark on taking like pills, maybe supplements, teas, and you see they have like this loose tools and they believe that they have done some cleansing. Or for weight loss, some people do a lot of cleansing before they embark on weight loss because they believe that will also help them to lose weight. And then some people with chronic conditions, they believe, or the treatment pathway includes cleansing before they embark on treatment. So I'm gonna give you what cleansing, detoxification originally means. Detoxification or cleansing is the ability of your body, the system of your body, to take out wastes and toxins. Remember, every day we are being faced with assaults, the air we breathe, the food we eat. Like, we make right decisions. Like, you wake up, you go to the grocery, and you want to make the right choice, buy the right kind of food. But when you're in the grocery store, you're seeing organic, non-organic, you pick up this container, you read the food label, you get overwhelmed, you're like, what? And you just pick it up and you leave. So we get overwhelmed by others in the society or in the community. But our body has a way of fighting all these things that we put in our body. So if your body is not able to do this for you, it means you're not cleansing properly. It means you're not detoxifying properly. So one, let us look at 5 basic natural filtering system or cleansing system that God gave us. Yeah. So let's start one, the skin. The skin is a large organ. So you should be able to cleanse or detoxify when you're able to sweat every day. Make sure you're sweating. If you're like during winter, you can say during winter I don't sweat. Exercise, walk around, be active in the house, do something to sweat. Make sure you're sweating. Sweating is good because it helps you take out metabolic waste like salt, sugar, urea from the skin. So that's waste. So if you think about it, if you're not sweating, it means you are not losing that weight. You are not detoxifying properly. Then a second organ, let's look at the kidney. I did talk about the kidney. You should go watch that video. The kidney is another major organ in cleansing and detoxifying because the kidney helps you to take out urine. So if you're not able to take out urine, you are not cleansing. 3, let's look at the liver. The liver is another organ involved in detoxification, breaking down medications. And the liver has these cells called Kupffer cells. They are like soldiers. What they do is absorb or look for foreign substances in your blood. They engulf them and take it out of the blood system. The liver is a major one. So if your liver is not doing well or not healthy, or you're doing things to your liver that is unhealthy, you're not detoxifying properly or cleansing properly. Number 4, let's look at the lungs. Your lung is another organ. So the lungs is another organ. Your lungs are another organs that helps to detoxify or cleanse your system. So you should be able to breathe in properly, breathe in oxygen, take out CO2, carbon dioxide. So when you're talking about cleansing and detoxification in relation to your lungs, think about the air you're breathing in. Think about secondhand smoke. Think about if you're smoking. Think about the mucus producing cell in your respiratory system. Usually we have the mucus so that it can trap like foreign substances. When something gets through your nose, you're able to sneeze or cough it out. That's one cleansing adaptive behavior that we have for our body. So if you're doing things that destroys the mucus, when you're overproducing mucus, like those who have been smoking for a long time, that means you're not cleansing properly. That's the lungs. So you should be able to breathe in clean air. You should have your environment, you should have clean air. Think about if you're living in industrial areas with polluted air, you're breathing in toxic fumes, toxic air that can be unhealthy and damaging to your lungs. So your lungs are involved in cleansing and detoxification. Let's talk about the GI system. Your stomach, your intestines, your colon are involved in cleansing. You should be able to move your bowel at least once daily, or depending. Some people can stay 2 days, which is their normal. So you should be able to move your bowel at least once, twice daily, depending on your age also. You should be able to move your bowel regularly without constipating. So if you're constipating, you are not cleansing properly. You are not detoxifying properly. If you're not eating, if you don't have the right amount of gut bacteria, you are not cleansing properly. Because remember, that bacteria helps in breaking down like fiber, and they'll give you the good nutrients and help you to take out the waste that you don't need. So you need your GI system to be involved in cleansing. And the last one is the lymphatic system. So the lymphatic system is like the nodes. It's like, I look at it as a sewage system to help you pass out waste and remove fluids like abnormal fluids in the blood system. When you have, let's say if you have like a sore throat, let's say you have like a wound here, usually you have like a lymph node here, you're gonna feel pain. That's a way of your lymph helping you to fight whatever that is going on here. So I've talked about the 5 major or natural cleansing filters that we have. We have the skin with your sweat. We have your GI system, your intestine, your colon. We have the lungs. We have the liver. We have the kidney. And what else did I miss? So 5, the lymphatic system. 5 of those are your cleansing filters in your body. So what am I saying? Every day you should be involved in activity to make sure that those 5 systems are working properly. You don't really have to set out a time for you to cleanse or to detoxify. So what do? Every day as you eat, as you set your food right in front of you, are you looking at food that can help detoxify? This should be included in your daily meal. So that's why I said daily you are cleansing, daily you are detoxifying. So when you place your food, you look at the nutrients you have before you. Are they involved? Are they helping this 5 major system in passing out waste and toxins from your body? So the next video I'm gonna do, we're gonna be talking about these toxins and food that can help you cleanse your system, especially for every healthy individual or people with cancer or chronic conditions or hormonal issues. Before I end this video, we're gonna look at the source of toxins. Why do you have to detoxify, or why do you have to have it in mind that whenever you're eating, you should be involved in detoxifying or cleansing? Okay guys, welcome back. So if you just watched the last video, you understand that cleansing and detoxification is an everyday thing. It happens naturally in our body. So your part, or the part to play, is to make sure those 5 major system or filtering system that I just listed to you, that they are functioning properly, which means you're eating right to make sure that those 5 systems are functioning properly. You make sure your liver is in good health. You make sure you're sweating daily. You make sure your kidney is functioning properly. You make sure you're not smoking so that you're not destroying the filter system in your respiratory pathway. You make sure your GI, you're moving your bowel every day. You have the right amount of gut bacteria. You make sure you're not constipating. You make sure your lymphatic system is flowing properly, like you're moving and you're hydrating, because when you're moving and hydrating, your lymphatic system is also moving and flowing. All right, that's like a sewage system. If your sewage system is clogged, nothing is moving. All right, so if you have more water flushing through, your sewage system, which is the lymphatic system, is working properly. So everyone needs this daily, even a baby. So a baby who is sucking a breast milk is already cleansing. A baby who is eating nutrient fortified milk is already cleansing, because the baby is getting the right nutrients. So it's all about eating healthy or complete balance, or let me use the word nutrient dense food. So each time you set your food on the table, or you make a 24-hour recall of what you ate, you should be able to tell if you ate the right proportion or portion or nutrient dense food that has all the nutrients to help you move your system or cleanse your system, or to help those 5 major filtering systems that I listed in the last video. So think about it. Some people say, oh, I don't cleanse, I never cleanse. When you pick up a cup of tea in the morning, you're already cleansing. When you drink water, you're already cleansing. When you drink the right amount of water, you're cleansing. So the right type of water, it's not tap water, it should be filtered water, right? So that's cleansing. But if you're taking like a tap water, which is not filtered, you are not cleansing. Actually, you are feeding your system with toxins. So now let's look at the sources of these toxins, which is the reason why we should be sure that we are detoxifying and cleansing every day. So in the next video, I'm going to put a different video on about the list of food that helps with cleansing, especially with cancer prevention and fighting cancer, in weight loss, hormonal imbalance, or chronic conditions, or autoimmune diseases. I'm going to give you some list of important food that you can include in your diet. Okay, so here let's look at one source of toxins. We'll look at food or behaviors that increase inflammation in the body. You already know one behavior. One is what? Smoking. Heavy alcohol consumption. That causes inflammation in the body. So that way your body is not able to cleanse properly. All right, so if you're having all that and you're eating the right food, or even cleansing in your way, you're actually not cleansing, because those 5 filtering systems are overburdened by smoking or heavy alcohol. So if you're involved in that, you're not naturally cleansing. So food high in refined carbohydrates, okay, like white rice, you should go for brown rice. Whole complex food are better than refined flours, refined rice. Processed food, processed snacks, fried fruits, the wrong kind of fats like hydrogenated and trans fat. When you deep fry your oil, those cause inflammation. If you're getting those kind of food or those kind of oil, vegetable seed oils like canola, you are not detoxifying or cleansing properly. Okay, and then let's look at sweeteners. Processed meat has nitrates. So nitrates causes inflammation. The nitrates, especially if you consume a lot of processed meats, they have this preservative nitrates in the meat that can cause inflammation. Sweeteners, artificial sweeteners, and like I said before, tap or filtered water can cause inflammation, and this is because they contain some bad chemicals or heavy metals. Okay, and what else in food? Okay, let's talk about GMO food, genetically modified food or genetically engineered food. They also can prevent your cleansing system from working effectively because of what they contain. Like GMO food, I'll give you a tip. When you want to buy a packaged food, make sure you're seeing non-GMO. Okay, we have like a lot of food, like from corn isolate, soy isolate. We have like beet sugar, all these things that are made from natural food. A lot of them, like you see the sweeteners, the there will be like cane syrup. All those can be, most of them are genetically modified. So usually go for the natural product. If you want to eat your corn, make sure it's not genetically modified. You know where it was grown, because a lot of corn you see in the market are genetically modified. Beet sugar, a lot of them genetically modified. Sweeteners, aspartame, a lot of them are genetically modified. So make sure, basically go for just not to get it complicated, go for natural food. Whatever that is man-made, you have to read properly before you pick it up and drop in your shopping cart. And then the big one now is, if I'm gonna just speak a little bit on that. That should be another video if I'm able to do that, but I needed to Google on that. This is called endocrine disruptors. This is like the worst. Like, it's like a big topic right now about chemicals we see in food, especially in cosmetics. So if you're like, especially we women that buy a lot of cosmetics, you have to read properly. So this one called endocrine disruptors, usually they mimic hormones in the body. And it's so sickening because we see a lot of little kids, in recent times, like they are overdeveloping. You see a little girl of few age has already matured, and you're wondering what's going on, because these hormones are injected into food, like eggs, milk, just to make sure. So they are injected in, like in the chickens or in the animals, so they can make eggs or become very productive. So when you consume this food, you get the hormones in your body, especially estrogen. Breast cancer is related to too much estrogen. A lot of the breast cancer is related to too much estrogen receptor breast cancer. So you have to read carefully. Like, you can look out for parabens, coal tar, you look out for formaldehyde, and a lot of this, especially parabens, you see it in a lot of cosmetic, like your cleansing lotion, your shampoos, your treatment regimen, or whatever you use. A lot of our dishwashers, a lot of for clothing. So a lot of this are found in the things we use at home. So be careful where you buy this. Make sure you're reading. And it's so annoying because they are very, very subtle. You can easily miss it. So imagine if you go to a store and you pick up like a toothpaste or powder, you're reading everything. It's so annoying because sometimes you miss it. They are not directly, like, boldly written for you. You have to look at it. So I will advise you to Google cancer causing toxins or endocrine disruptors. So these things can cause cancer.